And welcome to the Dr. Bob Show. The human nose is an amazing organ. It filters air, it warms the air, it humidifies the air that we breathe before it goes down to the lungs. Lots of things can go wrong with the nose, from the anatomy to the function of the nose. We'll be discussing that on this show and see how the nose can interfere with the way you feel. My guest is Dr. Laura Green. Dr. Green is a board-certified allergist, and she'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a rare form of chest pain that could mimic a heart attack, and cholesterol. You know that we need cholesterol? It's just that when we get too much, and especially of the bad kind, it can cause damage to arteries. We'll be learning more about cholesterol. Lots of information for you. You'll want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist, and we're talking about the human nose. Laura, welcome to the Dr. Bob Show. Tell me about the functions of the nose.
The nose does a few things. One of the big things that it does is it warms and humidifies air that we breathe in.
So how does it warm the air?
It travels through parts of the nose where there are a lot of blood vessels close to the surface, and as the air passes over it, it can warm the air.
And the body, the lungs, like warm air?
They do. When cold air hits the lungs, and people that spend a lot of time exercising outside in the winter may notice this, cold air isn't tolerated as well. It makes your chest hurt, it makes you feel tight in your chest sometimes.
So it warms the air. What else does it do?
It humidifies the air so that you're getting humid air down into the lungs, not dry air.
So how does it humidify the air?
You also have blood vessels close to the surface and mucus production that helps with humidifying the air.
So the mucus production has fluid in it, and you grab that moisture and take it down to the lung where it's nice and happy with warm, moist air.
Correct.
Can things go wrong with the nose that make it where it doesn't produce warm, moist air?
Yes, there are a lot of things that can go wrong with the nose, and people that live in this part of the country probably have noticed a lot of those.
So this area is notorious for that. Well, let's talk about an abnormal nose. Let's talk about the word rhinitis. What does rhinitis mean?
Rhinitis just means inflammation of the mucosa or the tissues in the nose.
So if we've got different types of rhinitis. Let's talk about allergic rhinitis. You're an allergist.
Sure.
Are there lots of allergies in this area of the country?
There are a lot of allergens in this part of the country, a lot of different things we breathe in from the environment that we can become allergic to. And anywhere from 10 to 30% of people in the United States may be sensitized to allergens that they're exposed to.
Are more and more people becoming allergic?
It's possible that more and more are becoming allergic, and we also recognize allergies better over time.
So we do better about diagnosing and asking the questions. I have heard that in European countries, up to 50% of the population can be allergic. What's the percentage in the United States, probably?
Probably somewhere from 10 to 30% have allergic rhinitis.
So what are some of the main allergens causing allergic rhinitis?
So we have seasonal allergens like pollens, trees, grasses, and weeds. And then we have things that are year-round. Those are going to be things like mold. We have mold spores in the air pretty much 365 days out of the year. Indoor allergens like dust mites in this part of the country will be year-round. And then for people with pets, cats and dogs would also be a year-round allergen.
So when we have seasonal, you're talking about spring and fall. What are the main spring allergens, and how do they really cause allergies?
So the big things that we have here in the spring are going to be trees and grasses. And trees start to pollinate actually very early here. We start to see tree pollen in the air usually by the end of February. So most people wouldn't think that it would be warm enough to have a significant degree of pollen yet, but we do. And then generally by the end of April, we already have grasses pollinating as well.
So we got a combination of trees and grasses. Now,
Right.
tree pollen, does that come from the bark of the tree, the trunk of the tree, or what part of the tree produces pollen?
It's coming more from the fruits of the tree. One of the big things that is probably confusing to some people is that the flowering trees aren't necessarily the ones that bother you as much. Those are pollinated by insects. So when we're talking about tree pollens and being the ones that bother people, it's the ones that are wind pollinated because they disperse large amounts of pollen into the air and it can travel for hundreds of miles. So those are the trees
Wow.
that tend to bother people more.
So if you have an oak tree in your yard, you don't have to cut it down because if you're allergic to oak pollen, it's going to come from the rest of the neighborhood you're in?
Correct. It wouldn't do any good for you to cut down trees in your immediate vicinity or to kill all the grass in your yard because it'll come from around.
Are there certain trees that produce more pollen?
There are, and those are the ones that are typically tested for on standard allergy testing, and that can vary by the region of the country because we have different things here in the southeast compared to maybe the northeast or even on the west coast.
So let's go from trees to grass pollen. Are there different kinds of grasses?
There are. There are various types of grass pollen. Some are going to be in northern parts of the country. Some are going to be more southern types of grasses.
So do they have a flower? Where does the pollen come from in grass? I just see a little blade of grass in my yard needs to be cut down. Where does the pollen come from?
So it's attached to the blades of grass, and when the grass is mowed in particular, that's when you can disperse grass pollen up into the air. And sometimes even mold spores can be attached to the grass pollen, and that's dispersed into the air when you mow.
So which causes more trouble, tree pollen or grass pollen, or it depends on the individual?
It depends on the individual and what you're allergic to.
So the pollen that's produced, what does the pollen look like and how does it cause the allergy reaction?
So it depends on the type of pollen, what it will look like when we look at it under a microscope. People always notice that pollen looks yellow and there's big swaths of pollen on the car.
Yeah, you can sort of write your name on a car. That's pollen?
That's pollen. And when we breathe this into the nose, for people that are allergic, they may notice an immediate hypersensitivity response with itching and sneezing and runny nose. Fast forward a few hours after that, what you tend to get is the congestion, and that's the late phase response of an allergic reaction.
So there's an early phase and a late phase. Which one seems to bother people the most?
The congestion really bothers people the most. When
I just can't breathe through my nose, and that makes you miserable.
Makes you miserable. Can't sleep, can't rest well, and then you're tired.
Yeah. So you just don't function well. It's amazing that the nose can control how we sleep and how we feel the rest of the day. Is there a good treatment for allergic noses to tree pollen and grass pollen?
Yes, there are great treatments. There are over-the-counter medications that can be helpful, like steroid nose sprays. If those are used consistently, they can be effective. There are over-the-counter antihistamines. If you want to really treat the allergy itself, then allergy shots can really be life-changing and can improve the quality of life.
What do the allergy shots do to help get rid of the allergy?
So allergy shots are basically giving someone a shot of the things that you're allergic to in increasing amounts over a period of time. That helps the immune system develop tolerance to those things so that when you breathe them in, they don't trigger that same response that they would with the itching and the sneezing or the congestion.
Are they more effective with trees or grasses or weeds in the fall?
They're effective for all of those. We can do shots for all of those.
So we can desensitize people or immunize people to the pollens. How do you determine which ones they're allergic to?
We do allergy skin testing, and we can determine which specific allergens seem to be causing the problems.
When we come back, we're going to talk a little bit about the ones that cause problems all year round. And then we got a lot more things to learn about the nose, so I'll have to get busy on my questions. A lot of information. What are the year-round allergens that cause problems? Can we desensitize those? Are there good medicines for those? How about dogs and cats? How about other problems that bother the nose, like a crooked nose or a sensitive nose, or changes in weather that bother the nose? A lot of information. You'll want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist. We're talking about the nose. We've talked about how it filters, how it warms, how it humidifies the air. We've talked about some of the problems with rhinitis, inflammation, allergic rhinitis, spring and fall, and now we're going to talk about perennial, all year-round allergens. What are the main ones that you think about?
Dust mites and molds are two big ones that we deal with year-round. And
what are dust mites?
Dust mites are tiny little mites that live in your pillows, your mattress, upholstered furniture, carpet, and they feed off of house dust. You can't see them. They're not like bed bugs, and you can't inspect your mattress, but they'll be there. And in parts of the country like the Southeast, where it's warm most of the year and our relative humidity is high throughout the year, they're just going to be in your household.
So what type of symptoms? If you've got dust mite allergy or mold allergy that causes problems all year round, what symptoms mainly?
It'll be the same as the tree pollens and the grass pollens, the itching, the runny nose, the stuffy nose. And I notice a lot of patients that have a dust mite allergy frequently will notice when they first wake up in the morning, they have a really stuffy nose.
And it's hard to clear that nose up sometimes first thing in the morning. Are there good medicines?
There are. The same medicines, a good steroid nose spray and a good antihistamine can be beneficial, and we can also do allergy shots for dust mites and molds.
Now you mentioned mold in this area of the country having lots of mold. Are there different kinds of mold that seem to cause more problems, or everyone's an individual?
Everyone's an individual, but we certainly have different types of mold. Some are very abundant in the outdoor air. We have mold that will be more prevalent after heavy rains. We also have dry day molds. So it's really something we never get a good break from. So
they cause year-round problems. You can't get away from mold. You can't get away from dust.
Right.
So you're in big trouble if you've got those. Talk to me about dog and cat allergies.
Dog and cat allergies exist, and if you have pets in your home, it can be a problem. If you have friends that have pets, or if you go to your grandparents' house and they have pets, it'll bother you there too.
Okay, and the same symptoms?
Same symptoms.
Same treatment?
Same treatment.
Can you desensitize to dogs and cats?
You can. We can do allergy shots for those.
So I want to walk into a sensitive nose. We've got an allergic nose, itchy, runny, sneezy, congestion, blocked head, makes you miserable. What about a sensitive nose? What do we call that?
So a sensitive nose we sometimes call vasomotor rhinitis or irritant rhinitis, and it's a type of non-allergic rhinitis where there's a heightened response to stimuli, and that can be from changes in barometric pressure, changes in temperature, spicy foods, hot or cold beverages, things like that.
Exhaust fumes, anything that
pollution
irritates the nose.
Correct.
Now, the symptoms that it causes, are they similar to the allergic nose?
It's very similar, and they can also be seasonal, just like allergic rhinitis, because the seasons are changing, the temperatures are changing.
So it gets really confusing. The way to figure out the difference between the sensitive, irritated nose and the allergic nose is by the allergy testing?
Correct.
And that will help you. Can you have both of them at the same time?
Yes, you can.
Common?
Pretty common, especially as we get older.
So, as we get older, then I'd have a lot of them. So let's talk about some other things that bother the nose. How about hormonal changes?
Yes, hormonal changes are a big one, especially for women. Any woman who's been pregnant may have noticed that she got a really stuffy nose when she was pregnant. That's in part due to different pregnancy hormones. It's in part due to increased blood volume. And there, unfortunately, is not a lot that will help with that other than delivery.
Yeah, good old saltwater spray and what I call tincture of thyme. And it is very difficult because women can't breathe and they've got a baby in their tummy, and so it's a very difficult time for women. Other things that bother the nose?
Other things that would bother the nose could be things like thyroid disease, especially if there's autoimmune thyroid disease, something about the antibodies that circulate through with that tend to make the nose very stuffy.
So you could have an inactive thyroid or a thyroid that's not performing well, and it manifests as a stuffy nose. So if somebody has a stuffy nose, it may not be vasomotor rhinitis, it may not be allergic rhinitis, it may be rhinitis that's due to those changes. How about weather changes? What's the weather seem to do to the nose?
Weather can certainly bother people, and it tends to cause problems with fluctuating runny nose and congestion. People tend to notice this at the change of seasons. So spring and fall would still be a time that people, even without allergic rhinitis, would have symptoms.
I want to walk into the association with allergic nose problems and other problems like asthma. Is there an association that seems to be with an allergic nose and allergic lungs?
Yes. So people that are sensitized or allergic to environmental allergens can have rhinitis by itself. They may also have lower airway symptoms with asthma.
So what are the symptoms of asthma?
So we would look for shortness of breath, chest tightness, possibly wheezing, and it may be when you're outside, it might not be.
So would it be the same things that are bothering the nose might be bothering the lungs, like cat dander, like tree pollen?
Yes.
Like weed pollen? So all of those things can cause a common airway, the nose and the lungs. Allergic rhinitis and allergic asthma. What's the
Correct.
treatment for asthma?
The mainstay of treatment, or the first line treatment for asthma, is an inhaled steroid through an inhaler. That would be the first step.
What does that do to lungs?
It helps, the steroid helps with inflammation in the lungs.
So I take it with asthma, there's inflammation from the allergic reaction that's
Correct.
causing some of the swelling.
Correct.
And the inhaled steroid helps take care of that. If you need more medicines, do you have other medicines that you add on to that?
Yes, there are other inhaled medicines that we can start. Treatment of the allergies in general are very helpful for asthma. If we desensitize or help someone build tolerance through allergy shots, that can really help asthma.
So allergy shots can help asthma as well as the allergic nose.
Yes.
So let's talk about, can the allergic nose, can the reaction in the nose, can the swelling and the blockage of the nose and the stuffiness of the nose, can it cause sinus disease?
It can, because when you have so much inflammation in the airways and in the sinuses, the nose doesn't drain well, and that can set you up for sinus infections. It can make you more likely to not fight off viruses and other things well, which will also cause inflammation.
And make it where you can't sleep and you can't taste your food and you can't perform well. It's amazing how the nose can guide a person's health. And you've told us that different allergens, different sensitivities, different things we're exposed to can make the nose abnormal and where it needs help. Laura Green, you're a wonderful teacher. I want to thank you for coming to the Dr. Bob Show. You've given us a lot of insight and a lot of information. I think one of the important things is how to differentiate the different types. You need to see the allergist, need to be skin tested, and then you'll be guided toward recovery.
Yes.
Thanks for coming to the
Thank
Dr.
you.
Bob Show. Great information for you and for me. Now you're going to want to stay tuned. We're going to be talking about a type of chest pain that's due to the anatomy of the chest, and also we'll be talking about other things that'll help improve your health. I want to thank Dr. Laura Green for her wonderful discussion on problems with the nose and how we can fix those problems. And now, questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, what is costochondritis? I had chest pain, and that was the diagnosis. Well, let's talk about chest pain. When people have chest pain, it can be due to several things. We'll always worry about the heart. The typical chest pain of heart disease, of heart attacks, is a pressure crushing pain in the middle of the chest. Sometimes it radiates up into the neck or to the jaw or down the left arm. Sometimes it doesn't radiate in those places. There can be other causes of chest pain. There can be pneumonia, there can be pleurisy, there can be irritation from a bronchitis that's there. But costochondritis is where the ribs go into cartilage, which hooks onto the breastbone. Therefore, we have chondritis. That's inflammation of cartilage as it hooks onto the bone. We don't know what causes costochondritis. It can be from abnormal type of activities like painting or lifting things or pulling things, but it causes inflammation and it really, really hurts. And if somebody takes a deep breath and moves the chest cage, that can cause discomfort and pain, and people begin to worry about, I wonder if I'm having a heart attack. When you wonder and you've got chest pain and it persists, the best thing to do is to have it checked out. Electrocardiogram will not show any signs of inflammation if there's costochondritis, and your doctor will be able to tell you if the chances are you're having a heart attack or not. With costochondritis, there's tenderness when you push on the chest cage. The treatment is usually rest, anti-inflammatory medications like ibuprofen, sometimes ice, and sometimes just a simple rest and it will get better. Rarely lasts longer than 2 months. Usually it'll last 4 or 5 days and your symptoms will be able to go away. Question number 2. Dr. Bob, how does cholesterol damage blood vessels? Well, let's talk about cholesterol. Cholesterol, we need cholesterol. It helps form the cell walls of all the cells that we have in the body. So number one, you got to have some cholesterol or you're not going to have any cellular structure. Cholesterol is part of the development of certain type of hormones like testosterone. And so it's good in the formation of various hormones that we have. However, cholesterol has a bad side of the story. Too much cholesterol, if the cholesterol goes too high, then we know that we begin to have an association of hardening of the arteries. What's happening with that? Well, if the cholesterol goes above 200 units, then it's elevated. There's a good cholesterol and a bad cholesterol. The good cholesterol is called HDL. I call it the happy cholesterol. And the LDL is the lousy cholesterol, the LDL. Now, the good cholesterol actually helps people with cholesterol in their blood vessels. It will go in the bloodstream and help remove some of the bad cholesterol from blood vessels. But the LDL is the form of cholesterol that, if oxidized, can actually go inside the lining of the blood vessels. So if you've got a blood vessel that's open like this, and you have the inside lining that gets cholesterol that begins to form in there, then it begins to narrow that blood vessel. That blood vessel carries blood to certain parts of the body, and when it carries it to that part of the body, it nourishes that part of the body. So if a cholesterol plaque begins to scar down the blood vessel, like rust on the inside of a pipe, then it can cause some damage. In the coronary arteries, if we get cholesterol that's deposited in the coronary arteries, then we can get coronary artery disease. Those same big blood vessels that come out of the heart that go down to the extremities can get cholesterol deposition and get hardening of the arteries and narrowing of the blood supply, where we can get cramps in our legs or we can get lack of good nutrition to the skin that supplies to the foot and the leg. So too much cholesterol, too much LDL, too much bad cholesterol is really bad for people's health. There are some things that we can do. We can eat properly, less fried fatty foods. We can be sure that we have more fruits and more vegetables in our diet. There are medications that can help lower the LDL, the lousy cholesterol, can bring it down to a normal level. We don't have many medicines that raise the good cholesterol. Exercise can do that. And so there are some things that we can do. And you have to work that out with your doctor. So you need to know what your cholesterol levels are, the total cholesterol, the HDL, the LDL, and get on the road to good health so that your blood vessels will stay healthy and you won't get high blood pressure, coronary artery disease, atherosclerosis. That's all the time that we have this show. I hope you've enjoyed it as much as I have. Remember those 4 things that we like. Exercise probably is important as anything, and it doesn't have to be vigorous exercise. get your tennis shoes out of the closet and go out for a walk. Start 10-minute walk, go to 15, go to 20, go to 30 minutes of brisk walking, and you do that 5 times a week. And that's going to give you the activity that you need to cut down on stress, to make you feel better, to lower your blood pressure, to make your weight more stable the way you want it to be. So make sure that exercise is part of your life. It will make you feel better. Get 7.5 hours sleep. If you're not sleeping well, figure out why that is. Are you not preparing yourself for sleep? Is there pain that's keeping you awake? Are there medications that are keeping you awake? Is the house too noisy? Know that you need to prepare for sleep like anything else you do and get ready for a good night's sleep. If you get 7.5 hours sleep, then the chances are that your brain will have time to refresh itself and you'll perform better, and the people around you will perform better. Eat properly. Spend some time figuring out what you want to eat. When you sit down to eat a meal, say, now I wonder how much my stomach can really hold. Because sometimes when we look at a plate of food, wow, there's a lot of food there for you to eat. So cut down on your portions, eat better foods, eat less frequently. Most of all, what is it we like? It's that laughter in your life. Find somebody that you love and tell stories and laugh a lot and giggle. And when you giggle a lot, you'll stay healthier and you'll stay happier.